Good morning and welcome to another Coffee with the County. Today I'm with Hannah Colby, who's in our Public Health Department through HHS and a community health specialist, right? Hello,
Correct.
Hannah. How are you?
I'm good. How about you this morning?
Good. Very good. Tell me about what is a community health specialist? What is it that you're responsible for here at the county?
Yeah, so community health specialists can look different in every health department. So my role is a little bit differently because I would say pretty much in public health we wear many different hats. So what I primarily work on for a community health specialist is that I coordinate the statewide health improvement partnership, also known as SHIP. So that program is 4 areas or priority areas that we work on. So that's Minnesota Moves, so active living, Minnesota Eats, and that's healthy eating. Then there is the Minnesota Wellbeing, so that's mental health, and then tobacco works, so in the schools and out in the community.
Okay.
So that's one portion that I do as a community health specialist. The other one is I'm a registered dietitian by background, so I do work in the Women, Infant, and Children program, also known as WIC, and then I'm out in the community doing anything with general health education. So in the schools, doing I Cook After School, doing some presentations of what the school might need, school wellness stuff, and then recently I was partnered with CARE and did their 55 and stronger pop-up senior centers and did a nutrition presentation on immune health. So kind of get to do a variety of things, which is exciting. Part of my job.
That does sound like a lot of hats for sure. You talked a little bit about WIC, and Liz Short was in, and we've done a program on WIC, and she was awesome at telling us what that's all about. But let's back up just for a second. You said dietitian by education or by trade, or
Yep.
Tell us about Hannah. How did we get lucky enough to get Hannah Colby at Aiken County?
Yeah, well, I started out at NDSU, so North Dakota State University, and that's where I got my degree from. Did my dietetic internship with Iowa State University, and then I started in the clinical field, so I was a clinical dietitian, did that for a little bit. But then I noticed this revolving door in the clinical, or we call it medical nutrition therapy, and so the patients would come in, they would see their doctor, they would get a referral, or we would see them inpatient, and they would go back out in the community. Then what, right? Mm-hmm. So then they would come back in. Are they still having barriers to address health and wellness, or specifically to nutrition that can lead to chronic diseases? And a lot of times they do have those behaviors where they're not able to make any of those lifestyle changes. So kind of wanted to dive into a little bit of community nutrition work and saw that Aiken County was looking for their first registered dietitian. And here I am, and I get to do exactly that, trying to work with the community and work towards better health outcomes where they live, work, and play.
That's awesome. And, it takes a special person to do that kind of stuff, and we have that with you, and we're lucky to have you here. How long have you been with Aiken County?
Oh, I just celebrated my 8-year anniversary this past November. So
Time
8 years.
flies,
I know.
huh?
I know.
So you're not originally from Aiken?
No, I grew up in relatively close proximity to Aiken, so in the Sandstone area, so just north of Hinckley. Played against Aiken in sports when I was in high school and wanted to come back to the country and landed here in Aiken.
And loved it ever since, right?
Yep, still here.
That's awesome. Well, thanks for doing that. Tell me a little bit about SHIP. Tell me what that does.
Yes.
What is SHIP?
Yeah, so SHIP is a program out of the Minnesota Department of Health. They have an office called OSHI, and they oversee the SHIP program. And believe it or not, there is a SHIP coordinator in every county across the state. Aiken County SHIP is part of Healthy Northland. We did a new name. Now we're called Northeast SHIP. So we're part of the 7-county area of the Arrowhead region. So that would be Aiken, Itasca, Coochin County, and then we have Carleton County, St. Louis County, Cook, and also Lake County. So we make up Northeast SHIP, and so there's a coordinator in every county, and then we work with our community and school partners, or just partners in general, on, hey, what's not working? And here are the Minnesota Eats, Minnesota Active Living, Minnesota Wellbeing, and also tobacco strategies that we're trying to tackle, where we're trying to do upstream preventative measures, then again trying to help those downstream, which can be the hospital clinic settings. So we partner with our community. So one example, I believe we're 2 years out now, but we put in a community garden up in Hill City. So that's access to their own nutrient-dense foods that they can grow. Is not a lot of people, some people live in town and they don't have access to gardens, like maybe out in the countryside if you want to do that kind of thing. So we put a community garden up in Hill City so people who live in town have that access. And then another example can be that we partnered with the city of Aiken, and we did a whole, I think it took like a year and a half, but we worked with the community, we worked with stakeholders, and we developed this concept map. So 5-10 years down the road, we know that we're kind of landlocked down there. So we developed this really intensive and really exciting plan that if the city of Aiken wanted to expand recreational opportunities, this is what our community identified, and we identified where these things can go. So when funding comes available, then we can implement that. So also wayfinding signage, we're trying to increase awareness at that new tank trail behind Paulbach. So not a lot of people know it's back there, or people visiting our towns. So there's going to be a new sign, wait for it, it's going to be coming soon on the Paulbach sign that says Aiken Recreational Trails that the city is purchasing, and going to get that identified. And then we'll have some trail markers back there and some maps, and partnership with the land department to do some grooming for the ski trails. So we can make that available all season for recreational opportunities for our community, and then also visitors who are in town.
Yeah, that's awesome. So important, the recreation, get outside, get working.
Yes.
And you're one of the ones that are very instrumental in working all of those programs through. I know that you have been involved in, maybe it was SHIP, maybe it wasn't, with food programs, one of them with Riverwood. I know you were working on that. Is that called the Fine Food Aiken County program? What is that? What kind of program is that?
Kind of separate, but we have it tied with Fine Food Aiken County. So I believe we're in year 2. It's called Food RX, or it's known as produce prescription programs across the state or nationwide. And Riverwood Healthcare Center was a recipient of a grant that MDH, and if you don't know what MDH is, that's the Minnesota Department of Health, received from a federal level called GUSNIP, and that stands for Gus Schumacher Nutrition Incentive Program. And it was a really extensive, and a lot of funding that came from the state level for Riverwood to implement a program such as Food RX. So we're in year 2. Now we're in what we call Winter Food RX, where the participants enrolled receive a box monthly. In Summer Food RX, it's twice a month, so bi-weekly they receive a Food RX box. And so they enroll by either their primary care provider, their doctor can put a referral in, or there's a self-referral. Sometimes we don't know that they're experiencing food insecurity, and it's just a 2-questionnaire, and you have to see a doctor at Riverwood to participate because it is a research grant. Sure. And so they can do it themselves with a referral, or they can see their doctor, and then once they're enrolled, then they receive this beautiful box that we are partnering with our local food hub called the Aiken Farmers Market Hub, and they get food from our local farmers. And I just did an extensive evaluation on this program in partnership with Riverwood, and wow, is this program really making an impact, not only with the participants that are in the program. We're hearing that they increase their fiber intake, it's lowering their A1C scores, which is a measurement for prediabetes or diabetes, and also we just heard yesterday that it's improving their brain health, and they're seeing improvement with their cognition. So it's really making an impact with the patients. And then also our farmer community. I think the number was like $36,000 that went back to our local economy, to the farmers, just in 1 year that we saw.
Incredible. That's incredible.
So it's a really, really successful program that we're seeing, and make an impact all around, not just from the participants, but all the way back to our farmers who are growing the food for them.
Yeah. So that a true definition of community, right? You guys are working to include the farmers, the farm to table stuff, all of the farmers market. And if you haven't checked out the farmers market here in Aiken and other areas, please do so. Get out there and check that out. But using that food and making sure that we're doing everything we can to support our residents in being healthy and having the right food and having food available, which, food insecurity is a huge problem, not just in Aiken County, but in many areas of the state and country. So we want to make sure that we're doing our part. Any other things that you want to
Well, hey, that's a good segue that we talked about food access and food insecurity, and that's actually where Find Food Aiken County came into place and what we created. So I was in charge of what we called the Community Food Resource Brochure, which had information about where are our farmers markets. You mentioned that, and where are our food shelves in our community. And then we know our geographical size of Aiken County is very vast. We neighbor a lot of different counties, and so someone from McGrath area might not necessarily come to a food shelf in Aiken. They might go to Sandstone or they might go to Mora. So we do have some information about surrounding counties with food shelves, farmers markets, stuff like that. And as I was expanding the brochure, I was running out of space, and hey, we're in 2024 with modern times, so we created a website, and it's called Find Food Aiken County. I will give credit to Carver County because we did not recreate the wheel on this. So we were given permission because they had Find Food Carver County, and we used the same thing, just took Aiken County's name into it, and we developed this website with a lot of different partnerships with MISA, which is the Minnesota Institution of Sustainable Agriculture, the Aiken Farmers Market Hub, Riverwood Healthcare Center, University of Minnesota Extension, our farmers. So there was a bunch of us that came together to create this website, and on that website, and it's just www.findfoodaikencounty.org, you'll find maps. We partner with our Aiken County GIS program, and they developed 2 maps. One of them is emergency food resources. That is anything with the food shelves. Also, Riverwood Healthcare Center has emergency food pantry packs that you can, if you're in need. And then our community food shelf at Aiken First Lutheran Church has emergency food boxes as well. So if you need food right now and don't know where to go, that's a map for you. Otherwise, we have a map on all foods resources, and hey, you just moved to Aiken, don't know where everything's at, don't know that Double D's has a meat market now? We have information on meat markets, grocery stores, convenience stores, farmers markets, you name it. We also have other areas just for seniors because we are the oldest population county in the state, so we know that's really important. So we also have information called just for seniors, and also there's facts, answers, and questions, also known as facts, and recipes. That's my favorite part. I oversee all these recipes. Nice. I think I uploaded over 50 recipes since we went live in July of 2024, and so there's all kinds of recipes online, videos, and then Ask a Dietitian, which is what I oversee and collaborate with a few other dietitians, hopefully here in the future. If you want to read anything about health and wellness or nutrition in general, you can go there, and I have some blogs available for the community to read.
So say the website again.
It is Find Food Aiken County, and you can go on your internet browser or on your phone with Google and just type in www.findfoodaikencounty.org.
So if you need the help, you need the hand, we're here to help you, here to support you. Reach out to that website. It'll answer all the questions you might need, whether it's where to go or questions on health and what to eat and what to eat right. And if you want to know how to make it, you got the recipes in there too. So that's really awesome. Thank you for doing that. I know it's tough work. I know it's refreshing work to make sure that we're making a change for our county and for our people.
Yep, very rewarding work, and it's really important to say too that a lot of the work that I mentioned I can't do without stakeholders and community partners. It really is a team collaborative, and very proud and fortunate that we do have change makers and leaders in our community that's willing to work alongside me and make some change towards some better health outcomes in our community.
Yeah, that's great. And we are very fortunate to have you, Hannah, as part of our organization here at Aiken County. Please stay forever and continue to do the great work that you're doing with our community.
Well, thank you.
Yeah, and thanks for being here today. Please stop by anytime you have any information that you want to get out to the listeners and the residents, and we'll be happy to put it out there and share that information.
Will do. There's always exciting work to pass along to the community to know what we're doing.
Thank you, Hannah. Hannah Colby from our public health.
Community health specialist and a dietitian.
Community health specialist. I promise I'll get that right. Thank you, Hannah, for coming in. You are listening to Coffee with the County.